Okay, I'm going to go ahead and talk about the skin in this online lecture. Um, so when you're observing the skin, you're going to inspect first, of course, and you're looking at general pigmentation. The skin tone is consistent with the genetic background. It can vary from a pinkish tan to a ruddy dark brown, light to dark brown, yellow or olive undertones. You have to remember that darker skinned people normally have areas of lighter pigmentation on the palms, nail beds, and the lips, and that their general pigmentation is darker in sun exposed areas. And then you might have common pigmentations such as freckles, um, moles, which is a nevus, or birthmarks. Now, what makes a skin lesion abnormal is you look for the mnemonic of A, B, C, D, E. A is for asymmetry of the lesion. B is for border irregularity. Color variation is C. D is a diameter greater than 6 millimeters, and E is elevation or enlargement. Um, an individual can report any kind of change in a mole's size, a new pigmented lesion, or the development of itching, burning, or bleeding in a mole. Any of these signs are suspicious and should be investigated, okay? Anyone with moles or birthmarks should perform periodic skin examinations, and again, looking for the ABCD uh, abnormalities. They can ask a family member to check the backs of any area, like their back or the back of their legs, that they cannot see. Any widespread color change, also for pallor, erythema, cyanosis, or jaundice, should be noted. In darker skinned people, you have to remember that the amount of normal pigment may mask color changes, so the best places to observe for color changes in darker skinned people are the lips and the nail beds. You also can use the areas with the least amount of pigmentation, which are under the tongue, the buccal mucosa, and the palpebral conjunctiva and the sclera. You use the back or dorsal side of your hand for temperature, and you palpate bilaterally. The skin on both sides should be warm with equal temperature to both sides. The hands and feet may be slightly cooler in a cooler environment. You're observing for any hypothermia or hyperthermia. You're observing for the amount of moisture that's on the skin. You have to remember that perspiration normally appears on the hands, face, axilla, and skin folds in response to activity, warm environments, and anxiety. Diaphoresis can accompany an increased metabolic rate, such as heavy activity or fever. You can also look for signs of dehydration in the oral mucous membranes. Normally there should be none. They should be smooth and moist and pink. Be aware that darker skin may normally look dry and flaky, but does not necessarily mean that there's dehydration. You need to feel the texture of the skin to make sure it's smooth and firm with an even surface. You're looking for any edema as well. It's most evident in dependent parts of the body, such as the feet, ankles, and sacral areas. And the skin may look puffy and tight. You also notice edema where the hair follicles are more prominent, and it looks like a pig skin or an orange peel look, that dimpling look. Make sure you note if there's any unilateral edema and it's not bilateral. You can use your thumbs to press firmly to check for edema. Normally the skin will stay smooth when you lift your thumb, but if the pressure leaves a dent, it's called pitting, and it's rated on a scale from 1 plus 1 for mild edema to plus 4 for a deep pitting edema. Edema itself can also mask the normal skin color and obscures pathological conditions such as jaundice or cyanosis. So you have to be aware of that as well. Bilateral edema, or edema that is generalized over the whole body, which is anasarca, suggest a central problem such as heart failure or kidney failure. You're observing for mobility and turgor of the skin. Mobility is decreased when there is edema, and poor turgor is a sign of dehydration or extreme weight loss. When you pinch the skin, it stays tented, and the best place to do it is under the clavicle, except when we talked about geriatrics, we talked about the sternum. You look for any vascularity or bruising. Cherry angiomas are those small, smooth, slightly raised, bright red dots that commonly appear on the trunks of older adults over 30. They normally increase in size and number, and when they're aging, they're not significant. You make sure to note any bruising, multiple bruising at different stages of healing, and excessive bruising above the knees or elbows is a sign of possible physical abuse. You have to document the presence of any tattoos and advise the person that the use of tattoo needles or tattoo parlas places them at an increased risk of Hep C. You need to observe for any needle marks or track marks from IV drug use. And these can be anywhere, in the AC, in the forearms, between the fingers, between the toes, anywhere that they think they can get away with doing it. You need to look at any lesions. You're going to note the color, the elevation, the pattern of the shape, the size, the location, and whether there's any exudate. You make sure you wear gloves if you anticipate any contact with blood, mucosa, body fluid, or an open skin lesion. Next, you're going to inspect and palpate the hair. You're looking at the color of the hair, the texture of the hair, and whether there are any lesions or parasites in the scalp. You're looking for hair distribution as well to see if there is good blood supply there. You're also looking at the cleanliness of the person. You're going to inspect and palpate the nails. The nail surface should be slightly curved or flat. The posterior and lateral nail folds are smooth and rounded. The nail edges should be smooth and rounded and well cared for. Spoon nails may be the result of iron deficiency anemia. Chronically dirty nails may suggest poor self-care or occupation in which keeps them possible to keep them clean. You're going to view the index finger at its profile and note the angle of the nail base, which should be about 160 degrees. You're going to be looking for clubbing of the nails also, which is an indication of congenital cyanotic heart disease, emphysema, or chronic bronchitis. The nail base may also feel spongy to palpation. The nail surface should be smooth and regular with no brittleness or splitting. The thickness should be uniform. And the nail bed should be translucent, or the translucent nail plate should be pink underneath. Apologize. You're looking for any discoloration. In dark-skinned people, there may have a brown-black pigmented areas or linear bands or streaks along the nail. You're going to check capillary refill by depressing the nail edge to blanch and then release. It should be less than 3 seconds. Cyanotic nail beds or sluggish color return are consider cardiovascular or respiratory dysfunction there. Now in infants, in African American infants or newborns, they have a lighter tone than their parents because their full melanotic color is evident in the nail beds and the scrotal folds. Mongolian spots are a common variation of hyperpigmentation in African Americans, Native American, and Hispanics and Asian babies, and the result of deep dermal melanocytes. It's a blue-black to purple macular area found on the sacrum of the buttocks, and it usually fades in the first year of life. We'll talk about that more when we talk about pediatrics. For adolescents, there's an increase in sebaceous gland activity, which increases oiliness and activity. And in the pregnant female, there are striae, which are stretch marks, silver to pink, that appear in the second trimester on the abdomen, breasts, and sometimes the thighs. Also on the abdomen, there's the line of linea nigra which appears to be a brownish black line down the middle of the midline. Chlasma is a regular brown patch of hyperpigmentation on the face, which also sometimes occurs in pregnant women or in women who take oral contraceptives. It usually disappears after delivery or cessation of pill use. There's also the possibility of vascular spiders that occur in 2 to 3 just a second. In 2/3 of pregnancies in white women, but less often in African American women. There are tiny red centers with radiating branches that occur on the face, neck, upper chest, and arms. In the aging adult, you have discolorations, liver spots, small flat brown macules that appear after extensive sun exposure on the forearms and the dorsum of the hands. They're not malignant. Moisture, they also have drier skin. The skin is itchy and appears flaky and loose. Skin tags are overgrowths of normal skin that form on a stalk and occur frequently on the eyelids, cheeks, neck, axilla, and trunks of older people. There's a thickness with aging. A thinning with aging as the parchment and subcutaneous fat diminishes. It's evident over the dorsum of the hands, the forearms, legs, and bony prominences. Also, older adults have decreased skin turgor, and the skin slowly recedes. Hair distribution is decreased. Hair growth is decreased. The amount of hair in the axilla and the pubic areas are also decreased. And after menopause, Caucasian women may develop bristly hairs on the chin or upper lips. In men, the coarse terminal hairs develop in the ears, the nose, the eyebrows, and although the beard's unchanged. Male pattern balding is a genetic trait. In men and women, the scalp hair usually turns gray because of decreased melanocyte function. The nail growth rate decreases, and local injuries may produce longitudinal ridges. You need to teach about a skin self-examination. Teach all of your patients about the ABCDE rule. They should use a well-lit room with a full-length mirror, and then also have a small handheld mirror as well. Again, they should ask for help from family members, and they should follow the sequence as follows. They should undress completely, looking at the forearms, the palms, the space between the fingers. Turn the hands over, back and forth, and study the backs of them as well. Face the mirror, bend the arms to the elbows. Look at the arms in the mirror. Face the mirror and study the entire body front. Start at the face and the neck, working your way over the torso and down the lower legs. Pivot to the right side facing the mirror. Study the sides of the upper arms, working down to the ankles, and repeat with the left side. With the back to the mirror, study the buttocks, thighs, and lower legs, and if that's not possible for them to do on alone, then they're going to ask somebody to do it for them. They can also use the handheld mirror to study the upper back. And then to look at the scalp, lifting the hair. You can use a blow dryer on a cool setting to help lift the hair. They can sit on a chair or the bed and study the insides of each leg and the soles of the feet. The soles of the feet is extremely important, especially in your diabetic patients. Since they have loss of sensation, diabetic patients have often stepped on objects and had things in their feet that they didn't even realize were there because of the decreased sensory perception in the feet. So we'll talk about that more when we talk about diabetes too. So that is down and dirty of the skin. I do want you to review table 5-2 on page 49 of Jarvis, which are your common shapes of skin lesions, just to be aware of that. And then also table 5-3 on page 50 and 51 of Jarvis to talk about your primary skin lesions so that you have some idea of the differences in them. And then on table 5-4 are your secondary skin lesions, and that's page 52 and 53 of Jarvis. And then your decubitus ulcers on 54 and 55.